Hello, this is Janet McCarthy, doctoral student of Loyola University Chicago, Marcella Niehoff School of Nursing. And I would like to share my research proposal entitled The Effect of Specific Nurse Manager Attributes on Staff Nurse Satisfaction and Intent to Stay. So a bit of background on my proposed study. The nurse manager is one of the most influential positions in a healthcare organization. The individual in this position interfaces with patients, family members, nursing and support staff, other healthcare providers, ancillary departments, and hospital administrators. Patient outcomes are influenced by staff nurse performance and the work environment. Effective staff nurse performance and positive patient outcomes contribute to organizational effectiveness. Oftentimes, the new nurse manager is not equipped with the necessary knowledge, skills, or attributes to be effective in the position. Inadequate nurse manager role preparation then can foster staff nurse dissatisfaction, which may adversely affect patient outcomes. The role of the nurse manager has been described by the American Organization of Nursing Leadership, or AONL, as comprised of three categories: the art, the science, and the leader within. The art, described as leading others, may be influenced by the nurse manager's authentic leadership ability. The science involves leading the organization, which may be developed with graduate-level academic preparation. And finally, the leader within, described as leading yourself, may be enabled by a high degree of emotional intelligence. The purpose then of this proposed study is to address attributes of the nurse manager in relation to authentic leadership ability, or the art, graduate academic preparation, the science, and level of emotional intelligence, the leader within, as well as the effect that a single attribute or combination of attributes has on staff nurse satisfaction and retention. Melisse's transitions theory will provide the theoretical framework and foundation for assessment of these attributes. The methods intended for this study include a quantitative correlational study, to include a nurse manager demographic survey, and then an authentic leadership inventory performed by the nurse manager for self-assessment, as well as staff nurse assessment of the nurse manager. In addition, an emotional intelligence survey will be utilized for the nurse manager to assess themselves, and then the staff nurse to assess their leader, their nurse manager. Results of this survey are not available because the study has not yet been undertaken. Implications for research and practice are really twofold, the first of which involves nurse manager selection and development. So an assessment of specific nurse manager attributes may reveal factors that would provide for appropriate nurse manager selection and enable role development, leading to nurse manager satisfaction and success in the position. Secondarily, staff satisfaction, patient outcomes, and organizational effectiveness may be improved as well if the nurse manager possesses attributes known to foster staff satisfaction, yielding positive patient outcomes. The likelihood that the nurse manager will remain in the position and contribute to unit effectiveness and positive organizational outcomes is therefore enhanced. And then the conclusion is not available, as I mentioned, as the study has not yet been undertaken. Thank you for your attention.